Dry skin in winter, your moisturizer isn't working. Here's what UK or USA dermatologists actually recommend. Dry skin in winter, your moisturizer isn't working. Here's what UK or USA dermatologists actually recommend. Welcome back to WA Health and Care. If you're struggling with dry, itchy, or flaky skin every winter, especially in cold regions like the UK and USA, you're not alone. Today we'll break down exactly why winter affects your skin, what precautions matter most, and the treatments dermatologists actually recommend to keep your skin healthy and hydrated. Dry skin in winter explanations. Dry skin in winter, your moisturizer isn't working. Here's what UK or USA dermatologists actually recommend. Dry skin during the winter season is extremely common across the UK and USA, and dermatologists consistently highlight this as a seasonal condition linked to both outdoor and indoor environments. When temperatures drop, the air outside becomes cold and holds very little moisture. According to several UK and US skin specialists, this dry air pulls hydration directly from the skin, weakening the natural barrier that protects against irritation and moisture loss. As a result, people experience tightness, itching, flakiness, redness, and in severe cases, small cracks on the skin. Indoor heating systems make this problem even more noticeable. Central heating, radiators, and electric heaters reduce humidity inside homes, causing the skin to dry out more quickly than usual. Dermatologists from both regions often mention that winter dryness worsens because most people take long, hot showers during cold weather. While hot water feels comforting, it strips away essential natural oils that keep the skin soft and protected. Using harsh soaps, strong exfoliators, and scented products further damages the skin barrier. Experts recommend several simple steps to manage winter dryness effectively. First, switch to lukewarm water and keep showers short. Immediately after bathing, within 2 minutes, apply a thick, fragrance-free moisturizer to lock in moisture. Dermatologists particularly suggest products containing ceramides, hyaluronic acid, shea butter, urea, or petroleum jelly. These ingredients help repair the skin barrier and restore long-lasting hydration. Using a humidifier indoors is a proven winter solution in the UK and USA because it adds moisture back into dry indoor air. Drinking plenty of water, increasing omega-3 rich foods, and avoiding overwashing the face also support healthier skin. Gentle cleansers and mild soaps work far better during winter than harsh alternatives. Shared by WA Health and Care, helping you maintain healthy, hydrated skin throughout the cold season. What are prevention and precautions for dry skin in winter, UK or USA? Preventing dry skin during the winter months requires a consistent and protective routine, especially in regions like the UK and USA where cold temperatures and indoor heating systems can quickly dehydrate the skin. Dermatologists across both regions emphasize that winter skin care is less about luxury and more about maintaining the skin's natural barrier. Following the right precautions can prevent itching, flakiness, redness, and irritation before they even begin. One of the most important preventive steps is adjusting water temperature. Experts strongly recommend avoiding hot showers, because hot water strips away the skin's essential oils. Lukewarm water is far more suitable during winter. Keeping showers short, around 5 to 8 minutes, helps the skin maintain its moisture balance. Immediately after bathing, a thick, fragrance-free moisturizer should be applied within 2 minutes. This timing allows the product to trap remaining surface moisture and strengthen the skin barrier. Dermatologists specifically recommend moisturizers containing ceramides, hyaluronic acid, glycerin, urea, shea butter, or petrolatum, as these ingredients provide long-lasting hydration in cold climates. Another essential precaution is controlling indoor air dryness. Because central heating and radiators reduce humidity, using a humidifier is highly effective in the UK and USA. It restores moisture in the air, preventing the skin from drying out overnight. Keeping the humidifier in the bedroom or living area can significantly reduce winter-related irritation. Dermatologists also advise switching to gentle, non-foaming cleansers. Harsh soaps and exfoliators, especially those with fragrances or alcohol, can damage the skin barrier. Limiting exfoliation to once a week is usually ideal during winter. Soft towels should be used to pat the skin dry instead of rubbing it, as friction can worsen irritation. Clothing choices matter as well. Wearing breathable, soft fabrics like cotton beneath sweaters helps prevent friction and itchiness. For outdoor protection, gloves and scarves shield the skin from cold winds that rapidly pull moisture away. Internal hydration is equally important. Drinking enough water, increasing omega-3 rich foods such as salmon, walnuts, and flax seeds, and including antioxidant-rich fruits help support skin health from within. Avoiding excessive caffeine and alcohol, both of which dehydrate the body, is also recommended. Finally, people with sensitive or extremely dry skin should avoid sudden temperature changes, such as moving directly from a heated room into very cold outdoor air. Gradual temperature transitions help the skin adjust without losing moisture. Shared by WA Health and Care, dedicated to helping you protect your skin throughout the winter season. What are treatments for dry skin in winter? Treating dry skin during winter requires a combination of the right products, consistent routines, and protective habits. Dermatologists across the UK and USA agree that the most effective winter treatments focus on repairing the skin barrier and restoring moisture levels that cold weather typically strips away. The first and most essential treatment is using a rich, fragrance-free moisturizer. Dermatologists strongly recommend formulas containing ceramides, hyaluronic acid, glycerin, shea butter, urea, or petrolatum. These ingredients work together to hydrate deeper layers, seal moisture, and repair damaged skin barriers. For extremely dry or cracked skin, petrolatum-based ointments can act as an overnight healing treatment, especially on hands, feet, and elbows. Another highly effective treatment is the use of overnight masks or thick creams designed for winter hydration. Applying them after your evening skincare routine helps the skin repair itself while you sleep. Face oils like jojoba oil or squalane are also beneficial because they mimic the skin's natural oils and provide long-lasting moisture. Humidifiers play an important role in treatment as well. Running a humidifier in your bedroom or living area adds moisture back into the air and prevents the skin from drying out while you sleep, something dermatologists in colder UK or USA regions often recommend. For irritated or inflamed dry skin, dermatologists suggest using 1% hydrocortisone cream for short-term relief, but only when necessary. Those with eczema or severely dry skin may benefit from prescription creams, so consulting a dermatologist is helpful. Gentle cleansing and avoiding harsh products also form part of winter treatment. Mild, non-foaming cleansers and avoiding overexfoliation allow the skin to heal faster. Shared by WA Health and Care to help you restore healthy, smooth, winter-ready skin. Thank you for watching WA Health and Care. If this winter skincare guide helped you understand your skin better, make sure to like, comment, and share it. And remember, small changes in your routine can completely transform your skin during the cold months. Stay healthy, stay hydrated, and I'll see you in the next video.